we are now going to continue with the diagnostic tests and procedures to evaluate our possibilities of your neurologic disorders. Common diagnostic tests and procedures used would be assessment of your cranial nerves, assessment of coordination and balance, assessment of neuromuscular function. We also have reflexes, lumbar puncture, electroencephalography, electromyography, and other radiologic studies. First one would be your cranial nerves. For your cranial nerves, again, we have 12 pairs. They are considered as part of your peripheral nervous system because they are found outside of the brain. They are not composed of the actual internal parts of your brain. The cranial nerves mediate your various motor, sensory, and your autonomic functions. So the cranial nerves enter and exit the brain rather than your spinal cord. The primary function of the cranial nerve is to control your sensory, your motor, and your autonomic activities of the head and the neck. So please take note of your cranial nerve 10, which is your vagus nerve, because it is very important since it affects autonomic, cardiac, respiratory, gastric, and gallbladder function. So this is very important when you're going to examine them, that you would have the advanced assessment skills in order to assess each cranial nerve individually. So again, this is for your reading to be included as part of your exam. Another way of evaluating or diagnosing neurologic disorders would be your Romberg test. For your Romberg test, this is very important in assessing coordination and balance. So how do we usually perform your Romberg test?
Perform the Romberg test, which primarily tests position sense. To do this, ask the patient to stand with his feet together. Normally, he should be able to maintain this posture with his eyes open, indicating intact cerebellar function. Now have the patient do the same thing for 20 to 30 seconds with his eyes closed. His posture should remain steady with only minimal swaying, indicating intact position sense. If the patient maintains this posture with his eyes open but not with his eyes closed, he has a positive Romberg test. Now check for pronator drift. To do this, ask the patient to hold his arms forward and parallel with the palms up and to close his eyes for 20 to 30 seconds. Normally, the patient can maintain this position, but watch for downward drifting of one arm and pronation of the forearm, which suggest mild hemiparesis.
Stay just as you are.
Finally, ask the patient to keep his arms up and eyes closed while you tap the arms briskly downward. Normally, the patient's arms return smoothly to the horizontal position.
Okay, so that is your Romberg test. That is a test commonly used to determine coordination and balance of the patient. Another would be the assessment of your pronator drift. Other means or ways on how to evaluate coordination of movements would be the following. First is to ask the patient to pat his or her knees with the palms of the hands and then with the backs of the hands in a rapid alternating manner. So I will be showing you how you do it. So for example, this is the knee of the patient. Diba nakaside yan? Yan, nakaside. That is the knee of the patient. So what are you going to do? You're going to ask them to pat the hands on the knees using the back and the front of the hands. So you're going to ask them to pat the knees like that. So dapat mabilisan. Another way of assessing coordination and balance would be holding up one of your fingers and instruct the patient to touch it with his or her index finger. You're just going to hold your finger like that and then ask them to also touch your finger using their finger. For the third one, ask the patient to touch his or her nose with the index finger, first with the eyes open and then with the eyes closed. So again, in this case, they will have to open their eyes and then ask them to touch their nose. Naturally, kaya nila yan. Next, you would ask them to close their eyes and then they will touch again their nose. If they would have a sense of coordination and balance, they would be able to touch their nose even with their eyes closed. Next, you also have here is to ask the patient to run the heel of one foot down the shin of the other leg and repeat with the opposite heel. So if you're going to illustrate that, for example, this is the foot. This is the foot and this is the shin is your lower leg. Okay? Your lower leg. So again, how are you going to do that? So this is the shin. This is the foot of the other leg. So this is your heel and this is your heel and this is your toe part. So they're going to run their heel over to the shin downward and then doing the same with the other leg. Next would be alternate tapping with the heel and then the toes of one foot and then the other foot. So for example, this is the floor. Yan yung floor, for example. They will have to use their foot to tap the floor using their heel and then their toe. Heel, toe, heel, toe. Okay. So those are other tests to determine coordination and balance. Next, let's move on with... Okay. Sensory function. For your sensory function, we will have to assess the presence of pain, temperature, light touch, vibration, position, and tactile discrimination. For the pain, we will have to assess the severity of the pain by asking the patient. First, of course, is to assess the presence of pain. If there is pain, assess the severity of the pain by using the pain rating scale, from 1 to 10, 10 being the highest and 1 being the lowest. How will you rate the pain? What else? Describe the pain that the patient is being felt. So in this case, ask the patient if is the pain, or you will have to ask the patient if the pain is sharp, is it dull. What else? You will also have to ask the onset, kailan siya nag-start, the duration of the pain, and then you will also have to ask if there is a possibility of radiating pain. In this case, for example, when there is chest pain, the patient feels pain on the left arm. So in this case, the pain originally starts from the chest, but eventually, because of radiating pain, the patient is able to feel pain also on the left arm. So we also have here your temperature. For the determination of temperature, you will ask the patient to touch a hot object and a cold object. Ask them whether it is hot or cold. For your light touch naman, in this case, you will have to get your cotton wisp or your cotton ball and have it brushed against the skin of the patient. Ask the patient to tell you kung nararamdaman niya na may naitatouch sa kanya na object. Next would be vibration. For your vibration, you will be using your tuning forks. You're going to strike the tuning fork para mag-vibrate siya, and then the end of the tuning fork will have to be touched on the skin of the patient. Ask the patient if they feel vibration or not. Next would be the position. You can do this by asking the patient or holding the patient's hand, and you're going to move the hand of the patient in a certain direction. And then they will have to identify kung saang direction pumupunta yung kamay nila. Next would be tactile discrimination, has something to do with touch. So the sensation of your touch. So we have here different tests. We have stereognosis, or the ability of a patient to identify a familiar object that is placed in his hand. Of course, kailangan nakatakip yung mata. So in this case, you're going to let the patient hold a certain object that is familiar to him. For example, a paper clip or a cotton ball or a small little ball, and then let them identify or guess what they are holding. Next would be graphesthesia. For your graphesthesia, you're going to test the patient's ability to recognize a number or letter that is written on the palm with a dull object. So in this case, you're not going to use any ball pen. You're not going to actually write on the palm of the patient, but you're just going to use a certain object to write a letter or a number on their palm, and then they will now have to identify kung ano yung number or kung ano yung letter na sinulat ninyo sa may palm. Another would be test point localization. For your test point localization, you're going to briefly touch the skin and ask the patient to touch the place where the sensation was felt. Next would be your diagnostic tests. Your diagnostic tests are the ones that are commonly used to identify possible neurologic disorders. So please, you will just have to read on the different tests and purpose, the patient preparation, and other post-procedure nursing cares you will have to consider when these procedures are being done to our patients. I will just highlight the important points that you will need to remember for your test. First one is your lumbar puncture. For your lumbar puncture, again, this is used to diagnose infections in the central nervous system. How do we do it? By getting a sample of the cerebrospinal fluid. So your role as nurses would be to prepare these patients who will undergo your lumbar tap or your lumbar puncture. So in this case, very important na meron tayong informed consent of our patients because this is an invasive procedure. The doctor will be inserting a needle into the spinal cord of our patients. Next would be explaining the procedure to the patient. Please take note that when you explain the procedure to the patient, dapat ensured kayo na nasabi na ng doktor kung paano gagawin yung procedure sa pasyente. What you will do as nurses would be to reinforce the procedure to the patient. So, dapat hindi kayo yung first time na mag-explain sa pasyente kung ano yung gagawin sa patient. Okay? So, in this case, ask the patient to urinate already so that you will not have to deal with distractions para hindi rin magiging it would also not cause discomfort on the part of the patient during the procedure. For the position that the patient will assume during this procedure would be either a sitting position or a knee to chest position na side lying. So there are actually two ways on how to do that. Kung sitting position, in this case, usually knee to chest rin ang pasyente. Kung side lying naman yung patient, knee to chest pa rin. For post-procedure nursing care, what are things you need to remember? For headache, again, we can help reduce the headache of our patient by asking them to lie flat for a specific period after the procedure. We also have here encourage oral fluids to replace the fluids that have been lost due to the procedure. And then we also have to assess the site for bleeding or leaking of your cerebrospinal fluid. Assess the vital signs and other sensations being felt by the patient. Okay, so I will show you how a lumbar tap is done.
In a spinal tap, which is also called a lumbar puncture, a local anesthetic is given, and a long needle is inserted into the subarachnoid space. In adults, a spinal tap is normally performed between the 3rd and 4th, or 4th and 5th lumbar vertebra. Because this region is inferior to the lowest portion of the spinal cord, it provides relatively safe access. The procedure is used for a variety of reasons. For diagnostic purposes, to introduce antibiotics, contrast media for myelography, or even anesthetics. Also, it can be used to administer chemotherapy, to measure cerebrospinal fluid pressure, and or to evaluate the effects of treatment for diseases such as meningitis.
In this case, the patient is placed on a side-lying position, a knee to chest position. First, they would have to inject the anesthetics so that the patient will feel no pain when the spinal needle is inserted. So that is the spinal needle. They will have to check first kung merong leaking of your CSF. Pag clear yung nagli-leak dyan, not blood, then that would indicate that you are able to hit the doctor is able to hit the spinal cord of the patient. And then they're going to get already samples of the CSF. Ayan. Okay, so that is how lumbar tap or lumbar puncture is being done. Next procedure would be your electroencephalography. Under your electroencephalography, commonly known as your EEG, it is commonly used to detect seizure activity by monitoring electrical activity in the brain. This is common in a lot of children because children usually experience a lot of seizures. We have here patient preparation. So you have to explain that electrodes will be applied to the scalp. So this is not an invasive procedure because you're just going to paste certain electrodes on the skull of the patient. In this case, we have to make sure that the patient would shampoo his hair before the EEG while because the oils of the scalp may prevent or avoid the electrodes from being attached into the scalp. So, kailangang malinis yan. Hindi rin magkakaroon ng electric shock on the patient. So, this is not true na nagkakaroon ng possibility na makuryente ang pasyente. In this case, again, so that we will be able to monitor the actual brain activity of the patient. What do? We have to withhold first the anticonvulsants, sedatives, stimulants, and tranquilizers, or any medication that would affect the activity of the brain. What else? We also have caffeine should also be withheld for up to 48 hours or 2 days before the scheduled electroencephalography procedure, or as ordered by the doctor, of course. For post-operative nursing care, help patient shampoo hair to remove electrode paste. I will show you again how they do this. Okay, so those are ways on how they usually assess brain activity for patients with seizure disorders. Next is your electromyography. Your electromyography, also known as your EMG, is useful in diagnosing neuromuscular abnormalities. Okay. Examples of neuromuscular abnormalities are your ALS, peripheral neuropathy, myasthenia gravis, and carpal tunnel syndrome. For patient preparation, very important that we sign consent. What else? Tell patient procedure takes 1 to 2 hours. For some, they would take faster. No caffeine or smoking for 3 hours before EMG because it could actually affect the activity of the brain or the nervous system. Inspect the sites of needle electrode placement. Patient may be instructed to return within 5 days to have blood drawn for enzyme tests for AST, CK, and your LD. Example of the electromyography, we have it here.
An EMG is an electrical test. It is designed to find out where some nerve damage might be in a person's body, particularly their arm or their leg, their neck or their back. Oftentimes, patients are going to need an EMG if they have numbness or tingling in a different area. The EMG will help us differentiate different causes for numbness and tingling. It can help figure out where a person's pain may be coming from. And it also may be the factor that decides how we treat a patient, particularly for patients who have multiple things on their x-rays or their MRIs. A lot of patients may have pain that is a mystery. They will come in, they'll have complaints, and they may have seen more than one doctor who's done a number of different tests, and they've all come back without an explanation. And that's a great opportunity to perform an EMG because that's a different modality to help find out why the patient is so uncomfortable. There is no other test like an EMG because it's not an imaging study. It's a direct test of the function of a patient's nerves.
Please take note also for your electromyography, sometimes they would use a needle. That is why signed consent is very important. Yan. Next, let's go to the other tests. We have the brain scan, the cerebral angioplasty, your CT scan, and then we also have here your MRI, pneumoencephalography, and then we also have here your Doppler flow. Very important ones that you have to focus on would be your MRI and your CT scan. So let's try to focus on these two first. So for computed tomography or your CT scan, again, it shows intracranial structures or take note that your CT scan would use radiation in order to view these intracranial structures. So when is it usually important? It is important when we use it to diagnose tumors, inflammation, edema, hematoma, and infarctions. It distinguishes normal from clotted blood, and CT scans may be done along with your angiography. So in this case, you have to put the patient on NPO for 4 to 8 hours before the scan. What else? Medications may be used for your patients. What else? Patient must lie still on a stretcher that fits into a donut-shaped frame that moves around the head. A mechanical sound may be heard, and procedure is painless and takes 15 to 20 minutes. Give sedatives as ordered for patients who cannot stay still. So again, for your computed tomography scan, it is usually commonly mistaken with your MRI. They are completely different tests. So let's try to see for your MRI later on. A very important consideration for your CT scan is that they should not be allergic to iodine-based media. So in this case, allergy is very important to look into for patients who will undergo your CT scan. Your MRI, on the other hand, does not use radiation if we compare it to your CT scan, which uses your radiation. It uses your magnetic field, kaya siya magnetic resonance imaging. So in this case, it also shows images of your intracranial structure. In terms of the actual machine that is used, kung sa CT scan, it will only use a donut-shaped machine. In this case, this is a bigger machine that is usually enclosed, where the patient is then asked to lie down inside of it. The problem with your MRI is that patients who are claustrophobic, or those who would have a phobia or who have fear of enclosed or closed spaces, would usually not find MRI as a possible diagnostic procedure, because they would usually get scared, or they would start reacting. They will start getting anxiety, or they will start getting scared when they're already inside the MRI. So in this case, other considerations would be to ensure that the patient does not have any metallic object inside of him, such as pacemakers. Why? Because since magnet ang gagamitin dito, it can actually alter, or it can alter the function of the pacemaker of the patient. So yun yung unang kino-consider natin for your MRI. Although this does not use any radiologic iodide or any contrast media, ang problema dito, it uses magnet. So metals are not allowed inside the machine. So in this case, what else? You would also hear loud drumming noises when the MRI starts scanning. What else? Sedation is important for patients who are claustrophobic. We also have here open MRI may be available for claustrophobic patients, and patients with some metal implants cannot be exposed to MRI because magnet can cause metal to move in the body. So special oxygen equipment, ventilators, and infusion pumps must be used for these patients. So I'll show you the difference between your CT scan and your MRI.
confusing. We get a lot of questions every day. CT is, in layman's terms, an X-ray machine hooked up to a computer. When we are scanning the patient, we lay the patient flat on the table. CT uses a thin, pencil-thin beam to take cross-sectional images of the patient's body. The beam rotates around the patient's body, and we slice the patient's body like a loaf of bread. That's how CT scans. It's utilizing radiation to take the images. It needs to be quick because in this day and age, of course, the biggest concern that we have being in imaging and radiology is to keep the doses as low and as safe as possible, but still give us that good quality diagnostic study. MRI stands for magnetic resonance imaging. MRI images the water molecules in the body, and it does that with a very strong magnetic field, which is the big cylindrical tube. That's the magnetic field in there. So if the patient were to lay down on the table right now, we would place their shoulder into that coil, and between the radio frequency, the strong magnetic field, and the coil, which acts as an antenna, we are going to produce images of the soft tissue and the bone with MRI. I think that's one of the things that patients get the most confused on. You know, a typical MRI is going to take at least 30 minutes. A CT scan is typically 5 minutes. CT is going to be excellent for the organs in the body. It's going to be excellent for bony detail. MRI, on the other hand, uses no radiation at all. It's using a strong magnetic field and radio frequency. Its specialty is soft tissue. I would definitely send him to CDI. I would send him there because I know what kind of quality scan.
Okay, so that is your CT scan and your MRI. Okay, next we will continue with the other topic. Okay, so now we continue with our Glasgow Coma Scale. For your Glasgow Coma Scale, again, this is the Glasgow Coma Scale, or your GCS scale, or your GCS, is very important in evaluating the consciousness level of a patient. So we usually use this to assess the level of consciousness of our patients. So there are 3 aspects of behavior that are independently measured as part of an assessment of a patient's GCS. So we have here the motor responsiveness, we have here the verbal performance or response, and we also have here your eye-opening response. So I showed you I uploaded a video on how Glasgow Coma Scale is done, or how do we evaluate the level of consciousness of our patients using your GCS. So kindly watch that also in addition to this lecture. So my lecture will only be short. So in this case, for your Glasgow Coma Scale, the highest possible score is 15 and the lowest possible score is 3. The highest possible score would indicate that the patient is fully conscious, while for a score of 3 would indicate that the patient is in coma or the patient is already dead. Again, for some discussions or for some books or references, a score of 8 or a score of 7 and below, or a score of 8 and below, would already indicate that the patient is in a critical state. So now let's continue for your eye-opening response. So the first thing that we check would be the eye-opening response of the patient. If the patient's eyes open spontaneously, meaning they would not have to, we do not need any stimuli for their eyes to open. So when their eyes open spontaneously, you would already give the score 4 points, 4 being the highest and 1 being the lowest. So please take note also that in your eye-opening response, the maximum possible score is 4. Best verbal response would be 5, and motor response would be 6. So for your eye-opening response, again, pag 4 yung score, you move on to your verbal response of your patient. If, however, the patient does not open his eyes spontaneously, that's the time you assess the patient further. You would score the patient with a 3 if his eyes would open to voice or to your sound. For example, you're going to speak to the patient, "Hey, Miss Smith, are you okay?" So if the patient's eyes open in response to the sound of your voice, then you would score that as 3. If the patient doesn't open their eyes in response to sound, you need to move on to assessing the eye opening to pain. So in this case, the score would be number 2. So how do we usually stimulate the patient, or how do we elicit pain to the patient for them to open their eyes? So again, there are actually 3 ways. First, by applying pressure to the patient's fingertips. Another is the one I mentioned about squeezing the trapezius muscle of the patient, known as your trapezius squeeze. And last one is your applying pressure to the patient's supraorbital notch. So I'll show you how you do that. Okay. So your supraorbital notch is actually an opening on the inner opening of your periorbital area. So it is found in here. You're going to elicit pain by pressing over the supraorbital notch. Yan. And then they would try to open their eyes. Okay. If the patient's eyes open in response to a painful stimulus, they would then have a score of 2. If there is no response even after eliciting pain on the patient, then you would give them a score of 1. If you are not able to test the patient because, for example, the patient cannot open their eyes due to edema of the eyes, trauma, or any dressing over the eyes of the patient, then you should just document it as NT, or not testable. Next would be your verbal response. Again, maximum score is 5. So when the patient is fully oriented, we mentioned that again, we try to assess orientation by asking them their name. So that is orientation to person, place, and time. So you ask them your name, or you ask them their name, ask them where they are at the moment, and ask them the date today. So when they're able to answer that, then you will give them a score of 5. If the patient, again, would have a confused conversation, you would give them a score of 4. In this case, the patient is able to reply, but the response does not, or it doesn't seem right. The response of the patient is not right. For example, if you ask them, "Mom, where are you now?" Then they would tell you, "I don't know where I am now. I don't know what day it is." So that is, again, an example of your confused conversation. What else? We also have here inappropriate words for a score of 3. In this case, when they answer you after you ask them a question, they would answer you pero random na words yung sinasabi nila. But then again, you would completely understand yung words na yon. However, they are not related to the question you are asking. Then you call that as inappropriate words. Then the score would be 3. Pag incomprehensible sounds naman would be 2 points. If after asking them a question, the patient would only make sounds but are not speaking words. For example, nag-groan lang yung pasyente after you talk to them. You call that incomprehensible sounds. Then you would give a score of 2. If there is no response at all from the patient, then that would be 1. Again, if you are not able to test the patient because, for example, na-intubate ang pasyente, of course, you cannot ask the patient to talk if the patient is intubated kasi hindi yan makakapagsalita. So, of course, that would already be NT, or not testable. Lastly would be your motor response. The maximum score that you would be giving them would be 6. So in this case, you should score the patient based on the highest scoring response you are able to elicit in any single limb. So any limb or any arm, right or left, or any leg, right or left, kung meron diyang may response, na they would follow you, then automatic you will just give them the highest score. So for example, if they were unable to move their right arm but they are able to obey commands with their left arm, then you would still give them 6 points. Okay. What else? Or how do you, or what commands can you tell the patient? An example of which is to ask the patient to lift their right arm and then let them make a fist using their right hand. So those are questions you can ask them. If the patient is able to do the commands you told them, then that would be 6 points. We also have here localizes to pain. For localizes pain, which would give you a point of 5. Examples are, again, squeezing one of the patient's trapezius muscles and applying pressure to the patient's supraorbital notch. Nasabi natin yan kanina. If the patient makes attempts to reach towards the site at which you are applying a painful stimulus and brings their hand above their clavicle, this would be classed as localizing to pain. Ibig sabihin, normally, the patient would guard the painful area. For example, pag ikaw, di ba, pag masakit ang tiyan mo, you would usually cover your abdomen. So that is localizing to pain. They would try to reach into the part of that area kung saan nagkakaroon ng pain sensation. So that is localizing to pain. Kung hindi man nila mahawakan, at least they start reaching it towards the site, or at least the hand is brought up to their clavicle, then that would still be a score of 5. For withdraws to pain naman, that would be a score of 4. So in this case, an example of which would be the patient tries to pull their arm away from you when applying a painful stimulus to their fingertip. So in this case, pag press mo over the fingertip of the patient and then the patient starts withdrawing the fingertip, then that would be your withdraws to pain. That the score will now be 4 points. Ayan. What else? Let's go to the next one. Ayan, flexion naman. Abnormal flexion response to pain would give you 3 points. Abnormal flexion to a painful stimulus typically involves adduction of the arm, internal rotation of the shoulder, pronation of the forearm, and wrist flexion, known as your decorticate posturing. So I'll be showing you the difference between your decorticate and your decerebrate. So for your abnormal flexion, you call that decorticate posturing. That would give you a score of 3. If the patient would have abnormal extension naman in response to pain, so in this case, the head is extended with the arms and legs also extended and internally rotated. The patient appears rigid with their teeth clenched. The signs can be on just one side of the body or on both sides, and it may just be in the upper limbs. So take note that in your decerebrate posturing, it usually indicates brain stem damage. So I'll show you an example. Ayan. So the first one, the upper one, is your decerebrate, and then the second one would be your decorticate posturing.